I'm Dr. Gerard Criner. I'm professor of medicine and chairman, Department of Medicine at Temple University Hospital. I'm also chief of pulmonary and critical care medicine. COPD is chronic obstructive pulmonary disease. 92% of the time it's caused by prior smoking, but some people have it because of born premature or diseases in utero or a genetic cause in about 2% of the population. It's a mixture of diseases which includes chronic bronchitis and emphysema that inhibits the patient's ability to empty their lungs. It's estimated that anywhere from 12 to 22 million United States inhabitants have COPD. In Philadelphia, it's probably about 4% of the 5% of the outpatient population at large have chronic bronchitis, and another 3 to 4% probably have emphysema. Usually patients are over the age of 40. They have a history of smoking at least 10 pack years, which means 1 pack of cigarettes per day for about 10 years. The major symptoms are cough, shortness of breath, limitation in exercise performance because they get short of breath, and productive sputum. The most important thing is not to smoke, and if they do smoke, stop smoking. That's the key factor that will help any patient who has COPD. Other things is to get diagnosed. A lot of the morbidity and mortality related with COPD is that patients are underdiagnosed and therefore they're not treated. In some studies, it's shown that close to 70% of patients aren't diagnosed and aren't appropriately treated. In the state of Pennsylvania, in the last fiscal year, about 34,000 patients in Pennsylvania were admitted for an acute exacerbation severe enough to cause hospitalization. There's not a standard treatment, but there is a standard approach, which is trying to understand the severity and type of disease that they have. If the patient has disease that's mainly due to emphysema, then patients will be evaluated to see if they're a candidate for certain forms of therapy. If patients have mainly airways disease that causes chronic bronchitis or asthmatic bronchitis, again, they're triaged to get certain forms of disease or certain forms of treatment that go along with that disease. If patients have severe forms of the disease, then there's an escalating, individualized approach to see what tests they need and what kind of therapies that they might need that would treat them for how severe their symptoms are. Lung transplant is an option, but that's a therapy that's relegated to patients who have no other alternatives to improve their care by optimized medical treatment. So what Temple Lung Center offers to the patient with lung disease is we offer them multidisciplinary approach to treatment. We bring in lung doctors, radiologists, thoracic surgeons, cardiologists, and pathologists to work together to come up with the appropriate treatment for a patient. We try to individualize the treatment for each patient. We try to look and see what conventionally can be done and what more can be done by patients participating in clinical research. Try to engage the patients in their care. We work with the referring physician so that we can come up with a collaborative plan with them on how to take care of difficult patients. We also have at the forefront a tripartite mission, which means excellence in clinical care, education, and research. If we blend all those things together, educating the doctors of the future, educating the patients of their family, plus research, we end up having an approach to the patient in a treatment format that will always allow us to be at the forefront of the care that we deliver and hopefully better care in the future.